Let me give you 3 tips for brand positioning as a doctor, as a surgeon. Whether you're just starting out in private practice or you are in that important phase of maybe scaling your private practice or rebranding, though that might be one of your options. Whatever your situation, these brand positioning tactics can make a massive difference if your focus is to generate the right volume of patient numbers and the right patients for your practice. Number 1, make sure you've got a good visibility in Google. When patients are actively searching for the services that you offer, make sure that you are visible, that you appear, that if they're part of, if they're doing this Google research and looking for specific information about the conditions that you treat or the procedures that you offer, make sure you've got some really powerful Google optimized pages in place. It's called search engine optimization. Quite often there's some confusion about what that means. People will sell you SEO services away from your website, creating links to your website. That's old school. Google looks at great content, so having great content in place is step 1, 2, and 3 if you want of having a content strategy in place. Now, number 2 of these tips and tricks for brand positioning would be to have a really great about us or about me page. A page that shows you, obviously, but also gives the essence of who you are as a surgeon, as a doctor, as a specialist. Make the information palatable, make it human. Don't make it just about the qualifications, your fellowships, your hospital associations. Make it about you, so you give people a compelling reason to spend more time on your profile, to consider you as their specialist and maybe ask for that referral or change an existing referral. Now, tip number 3 goes just away from your website, which is the LinkedIn profile that you hopefully have. Make sure it's up to date. Make sure there are regular posts. Make sure that your profile has the right information in the right place. You've got some featured articles there. You've got some activity, posting, commenting, adding content whenever's possible. That would be tip number 3. So, in brief, have Google optimized pages in place. Make sure your about page is really telling the story of your practice, and make sure your LinkedIn profile is up to date if referring GPs want to track you down there and get in touch there. If you need some assistance with your brand positioning, as I said, starting from scratch or rebranding, just book a free one-on-one strategy session, and I look forward to helping you build your private practice.